iCare at home technology provides one of the key missing links in the treatment of glaucoma. What is glaucoma? Glaucoma is typically thought of as being a condition where there's too high of a pressure in your eyes and damage ensues. The fact is, sometimes there's not too high of a pressure, but you have weaker eyes that suffer damage at lower pressures. But classically, most glaucoma is due to an elevated intraocular pressure. Most people are, well, everyone is seen between the hours of, quote, 9 to 5 and to see their eye doctor, and pressures are captured there, when in fact we have all the hours between 5 and 9 where pressures tend to be higher. So what is the typical experience in the data that we capture in treating your glaucoma? We take pictures, we look at the back of the eye, what does the optic nerve and retina look like? We do scans, perform scans in this thing called an OCT to look at the thicknesses of your nerve fiber layer. We run visual fields where you click the clicker when you do or don't see lights off to your side to see if there's field loss. We'll look at the drainage system in the eye and to see if that's open or closed or partially occluded. All these things that I just spoke about are the answer you get during the day is the same answer you have at 2 o'clock in the morning or after hours. The one thing that's variable is what are your pressures? The typical experience of the doctor, eye doctor, is we're going to find out what your pressures are and what we want them to be, and drugs, lasers, surgeries introduced in order to get to that goal. But what happens is, what happens if and when your pressures after hours are higher than that goal? Well, if we had that information, we would do something about it, but now we do. And what we have is this technology called iCare at home. I'm Dr. Wilcox of the Wilcox Eye Center, and we're the first location in Virginia to have this technology. And this technology follows this technology, which is the same thing, different applications. Pressures are captured in the office, and they're the same quality pressures as the ones you're familiar with the yellow dye and the blue light called the Glaucoma tonometer. So what happens? The experience is the patient usually rents this for a week, and they are able to capture 30 to 40 pressures over a week versus the 2 to 3 to 4 pressures that are captured over a year. That huge amount of data is used to understand what your pressures are now, quote, 24 hours a day. So the patient comes in, they're taught how to use this thing, they use it, they apply it to their eyes 4 to 5 times a day. The instrument is returned, and we use the information to decide on modifying your treatment protocols. Also, patients can purchase this technology and to use on a routine basis throughout the year. And those are usually the patients who have more advanced glaucoma or more concerned about that because of a negative family history associated with glaucoma. The iCare at home technology is fantastic. Their studies show that half of the patients who go through this, the doctor modifies their treatment because they are surprised to find or learn that their pressures are out of an acceptable range. And we're finding that clinically in office as well. You don't have to be our patient to use this. You can come by, be signed up and rent it or purchase it, and we'll teach you how to use it. And that information can be given to your current eye doctor. I'm Dr. Wilcox of the Wilcox Eye Center. We love taking care of our patients with advanced technology, and this is the latest and greatest. And we would love to help you help yourself. Thank you and have a great day.